we're at knee extension. And I'm trying to focus on the stuff that I have done more of. Thankfully with the core stuff, a lot more good information is out there and available for that now. So I'm not as worried about people not being able to access information on how to do core strengthening. Now, in this orientation, part of what I'm going to cover, we'll talk about the firing pattern piece, but I also want to try to talk about how these can be used as kind of, sort of, like calling it a quick fix feels like a gimmick to me. But things to consider as go-to interventions to get results, because they do always work well. Now, first assessment would be, so let's call this the pre-actual massage assessment. The orientation of these muscles, and you're not to your muscle chapter yet, so I'm not worried about you memorizing it yet. But thinking about where is the belly of the muscle, the thickest part of it, where most of the activity should occur, because it has the most muscle fibers, thereby where most of the movement could be done. So here are the quads. I'm going to peel off. Here on the anterior leg, remember that you really have kind of these two alien structures that create a bit of a V that splay out and then go either to the medial side of the knee or come over and go on the lateral side of the knee. I think of it like brackets on either side of the leg, starting up near the hip, starting at the hip, and then going all the way down on either side of the knee. This one, for your trivia experiences, is the longest muscle in the body. Anybody know it? Sartorius.
I'm cheating. I'm sorry.
Sartorius.
In the science book 449.
There you go.
I'm looking at the muscles in the leg, so I've got it like splayed out.
Sartorius is actually really cool. We were talking earlier about the muscle compartments and how they can get stuck together, right? Sartorius is this crazy superficial muscle, but underneath of it, here's the division between the adductors and the quadriceps, the muscles that do adduction of the hip and the muscles that do hip flexion and knee extension of, right? And look what the passageway is used for, and artery. So a very important channel. If these areas are stuck together, that's going to limit and potentially pinch there. So even from a circulation standpoint, it can be important to just pull these structures generally away from this line and pull these structures away from that line, so that those tubes that live in that line are happier. We don't have to push on the tubes. We're just trying to make room for the tubes, make the canyon bigger. That's tensor fasciolata. It's this little guy, which is the predominant controller for the tension of tensor fasciolata. Now we get to the actual quadriceps muscles. And this would be what we're trying to palpate. In this case, relative to knee extension. This is the only one of the quadriceps muscles that functions at the hip and the knee. So we learned rectus abdominis, and that's on the anterior side of the body. This is rectus femoris. So rectus means the middle of, rectus middle of the abdomen, rectus femoris, rectus middle of the femur. So not too bad. For me, it helped a lot from a visual standpoint, rectus, rectus. If you can see them both from the anterior side of the body, there you go. Then you have three vastuses: vastus lateralis, vastus intermedius, and vastus medialis. As long as you know vastus, then you're just saying it's the medial one, the lateral one, and the in-between one. The way that these are laid out, though, and this obviously intermedius isn't well represented here, it's just what is most important to identify are these two, lateralis versus medialis. Regardless of what the book initially says, this is my shortcut for you. The tendency for people is that they get too dominant and tight in lateralis, and this does often correlate with lateralis getting stuck to tensor fasciae lata. So this application has been one that I've just gone to a million times for managing this lateral leg IT band tightness sensation that people have. It's a really good go-to for, this is the area that they say they want some focus on. This is a way where you can get a lot of like benefit, more than just unsticking it, because you're going to be talking to some other things relative to knee function and even patellar function, while also getting this all unstuck. Because all this is going to include compression plus active movement. If I'm compressing along this line, right, and I have a person move the structures under what I'm pushing on, there's going to be friction and they'll get unstuck. So, important. Yeah. But look at the orientation of vastus medialis. The belly of its muscle is much lower. Look at how it has more mass down here. Have you ever looked at a big bodybuilder? And you see that, that's what that is. And why it's so important. The muscle that is closest to the joint tends to be the one that should be the initial activator. So this one, can we guess which one should be number one as the mover here? If it's the obliques and then rectus, what should it be here?
Should be medialis.
It should be medialis. Medialis should be the primary one. What's important for you is to know how to palpate it. You don't palpate it like this. I'm not on the belly of the muscle. I don't want to palpate it like this, because now I'm not in the belly of this muscle. So I need to palpate it like this. Just visualizing how it's not symmetrical. Okay? So the simplified version here, and I use this even when it was just working on people's quads and this was sensitive. Like it was just ouchy to apply like a fair amount of pressure here on the lateral anterior leg. If you have a person concentrically shorten it while you push on it, it's less ouchy. So it's actually a more comfortable way to work on that area if it's overly sensitive. And I'm going to palpate. So on the medial side, closer to the knee, lateral side, higher up. So I got like about a hand breadth in between my applications. And I have to identify where the patella is, because I gotta, let's say they're turned out real far or something like that. Make sure you identify like where that is so you actually are where you're supposed to be. Now, one of the important elements of what action I explain to people to do, Javier will be familiar with this one a couple weeks ago, is there's a difference in function between this and this. They're both knee extension, right? Knee extension, but I'm not pushing my body weight up with this. I'm just, usually during a walking phase, I'm swinging at the hip and momentum and everything will kind of carry this. So there's a difference a little bit functionally from that to having the ankle and the hip in line with one another and fighting gravity, pushing your body weight up. That'll produce more activity here because that's how the body was programmed related to actually getting you stood up first. So when I explain to the client how to do this, I'll show them not to kick their leg up where their heel clears the table. I want their heel to stay on the table and for them to push their knee down into the bolster. And the bolster then acts as my point of resistance. I don't have to do it. So always have the bolster there for you. And they have to look at you, like I'll show them, like not a kick, but a shh, you know, all that. So point, point. I'm going to flatten the knee. And back down. Kind of felt like initially, happened at the same time. Usually what I then do is have them slow it down. So slow it down, do it again. And actually that kicked on pretty good. And she would be a unusual client. You will find plenty of people that don't have any tone here. I'll go ahead and left leg. down. And this one, lateralis first. I'll do one more check. And again. But this one, medialis, is listening. Now, worst case scenario, we fix it anyway, because the only bad thing we could be doing is a pattern that's already strong and correct. We're reinforcing it. So it's never wrong to just fix it anyway. Getting lost in the subtleties of palpating these tends to frustrate people and overwhelm them because you're just not certain. Like they're fired at the same time, and now you have the person do this active movement thing, and you're not doing massage, and it all starts to feel clumsy. So palpate it, maybe up to 4 times, and then just go to it. Worst case scenario, as I said, I tend to prefer the idea of just fix it anyway. Now, with this, I'm going to show on this one, fixing it anyway. This is the wrong one. I'm going to go over here and reinforce and fix this one anyway. I want to use this exercise a little bit as a way of showing how to get to some of these areas of the body more effectively with your body mechanics too. All right, so what would I do? And this is also a place where I'll use Topotman as a way of sending a signal to activate. If the story I'm trying to tell is you calm down, you wake up. You shut down, you wake up. Inhibitory pressure is the shutdown button, and the tap is a way to sensitize and wake things up. It can be just a way for me to tactily tell them where I'm trying to get them to activate. It can be that, or it can be a little bit of a kind of using vibration. And because it can be frustrating, believe me, when, let's say you're in a therapy situation, somebody's telling you to activate something and you physically can't find the muscle in your body. Like you can't seem to get that thing to activate. And so giving them some kind of a stimulus, that's where like a TENS unit that does things, right? It directly activates it. So I wish I could be that, not that electric. But. So inhibitory pressure, you can find my spots. There you go. Trying to keep it broad so I can cover as much of lateralis as possible while also going along the line. Let's say that seam is IT band, so trying to get a couple things done at once, right?
Okay. So maybe, so inhibitory pressure. What is that?
Inhibitory pressure is just static compression and let go with the goal of inhibiting muscle activity. So inhibitory pressure is the term that we'll always use for what I use compression for when I want a muscle to become less active.
So
to
there's a
deactivate
particular
or
amount of
loosen
pressure that you must use for that.
Depending on the muscle. What layer of muscle is it? If it's superficial, this is pretty superficial, so it doesn't need as much pressure as a very deep muscle or a very thick muscle. So your awareness of the anatomy will dictate that. And
do you feel it are you feeling for a particular sensation to know that you're inhibiting the muscle?
That's an excellent statement. So with muscle testing, if you push and you don't feel what you're pushing on change shape, then you're not on the right, you're not either not in the right spot or you're not at the right depth. I should be denting the structure enough to where the muscle tissue itself is compressed and squashed, where the fibers are distended. That way, when they contract under me and shorten, because when I push on it, inhibitory pressure, not inhibitory pressure, but compression on tissue will take the fibers and squash them away from what you're pushing on. And then when they concentrically shorten them, you will feel it forcefully push back up on against you. Just like grab your own forearms. Remember, do this for me. Grab your own forearms, like really get a hunk and hold strong, and then make a fist, a really strong fist. And you should feel everything push your fingers out and away. And you can dent deeper in, and then you make a fist, and then I'm suddenly being forced and pushed out. I want that sensation. Now, I don't have to push to the point that they can't do that. This is a conversation of saying, like, yes, it's not saying completely turn off, it's saying less. And in this conversation, this is being told less while this one isn't being pushed on at all. If anything, it's being agitated. So the conversation is, you shush, you come on, wake up. So inhibitory pressure, and I'll say, okay, activate, good. Give them a little tap. Good, let go, nice and easy. And then I'll chase the areas where it feels like it's more tonic. I felt something higher up, so I go to the next area. It's not necessarily a knot or a trigger point or whatever we want to call it. Go ahead and activate again. Good, let go. And I could use that everywhere, even just relative to getting IT band and vastus lateralis unstuck. This is a really good tactic of working on the quads. Just go right to them, have a person activate, good, let go, and I'll work my way up, and again, good, let go. Ideally, I would have them hold the contraction a little bit longer. Does that feel like a bit more of a thing? So see that quick thing? I felt something, I clarified. All right, it doesn't take a lot. Does that feel like a thing? And they go, yeah. Okay, good. Activate, hold it. Okay, good. Down nice and easy. Next one, slow it down. Okay, still got it? Okay, good. Activate. Hold, hold, hold. Okay, slowly back down, slow, slow. There. Now I'm actually chasing it back down. Okay, again. Good.
Chasing
Nice
it
and
back
slow.
down.
And let go.
Chasing it back down.
Oh, I started my applications here, working up,
Okay.
and then I felt like I was going back down. Should have said proximal and distal and distal.
No,
distal to proximal.
Downward. It's just that I thought you were chasing something. There's
Yeah.
a particular thing you were feeling for the
Right.
rotation.
Now, in this area and others, but this is one where it feels like it particularly works well, this oscillation, trying to lift the quads up and away. It's the one time where I truly do use my thumbs. And just thinking about these layers of stuff. If you can just jostle it all around, what happens, right? So my fingers are actually along the line. I'm trying to be along the line between the quads and the adductors, while my thumbs are between the IT band and vastus lateralis. I'm trying to say, come on, quads, be unstuck. I'm also getting all that oscillation at the hip and the knee and even the ankle. Now, in supine position, this is not firing patterns, but it's important stuff related to working the area. Having them externally rotate just a little bit, and I tend to do this. Now, always have the bolster underneath, right? That supports the knee, protects the hip. I do this to even further exaggerate that. So my palm is down on the bolster, and I can use this even going further up, and it's pulling the posterior and medial tissue more out toward me. So if I apply pressure here, I'm actually pushing it into what feels like the back of my hand or even the posterior side of my forearm. That's one trick I have, just stabilizing their body. The sheet could be pinned there as well. And then I can come here and work along the adductors. With a forearm, you're not gonna go anywhere, as long as it's not palms, it's usually less invasive and everything like that. And it's downhill, so you gotta be careful with not having too much lotion in or anything. But through all of this, your best angle on most of the adductors is sideline. But there are chunks of them that run a bit more anterior and they're hard to get to. So it's worthwhile to go along this line. You don't have to try to force your way all the way down. You can see the seam on the inside of the leg. Like, I don't gotta go that far, especially if I use sideline. I did sideline, that part got covered. I just need to go along this more anterior medial line. And the goal being, who knows? Was it that dysfunction was happening at the knee because the adductors were so tight and that T-band was so tight that they're kind of just glued to the quads and that's disrupting their function? It tends to be both, because if one part of that exists long enough, if the firing patterns are disorganized or inefficient, is a better word, then over time that'll limit effective mobility of the tissue and things will freeze up. So you gotta always think about unsticking layers and then ideally finding a way to get them functioning more appropriately. Now let me do this more in like real time. Fine sling supine, drape, kind of here, starting more light, just palpating, making it feel like massage, and just feeling if things feel stuck. And yes, up here, something feels stuck. Along this internal line, everything's feeling kind of just stuck. The hamstrings feel, but to be honest, that's easier to interface with than like not feeling something that makes sense, right? So usually in this, I would start with unsticking everything. I would just go right into, all right, we'll unstick the, that's why externally, look how externally rotated the hip actually is. The foot's almost, on the lateral side, the foot's almost flat on the table. I work my way along these lines. Something a little bit there. Just a little extra attention. Work my way up.
So when you say stuck, it's like firmness and tightness is what you're saying?
Yep. And as the anatomy builds up, it's going to be, is the muscle, does an individual muscle or a group of muscles feel tight, or is it the line between the muscles? And in that case, it was the line between the adductors and the quads. Now I'm coming more anterior. See how the foot's oriented? So I just keep rolling that leg over, not really changing how I'm using my forearm. Going downhill is a little bit less efficient, but now I'm just going along rectus femoris, and underneath of it, rectus intermedius, vastus intermedius. Work my way out. Now I'm rolling the leg internally, feeling along that line of IT band and vastus lateralis. There was something, there was a speed bump. Just I roll over it. So that'll be a spot I come back to and focus on. And then I get myself set. And I've already explained the plan of the action. Okay, activate. Okay. Good. Nice and slow. Work my way back up. That wasn't, that's just the pocket. Activate. Okay, I see.
I saw her toe twitching.
That was right. But, and not go. Does it feel more comfortable when you're activating it? Or when you're not? It's way more comfortable when you're activating it. Go ahead again. And good.
It's the letdown that it's like,
Yeah.
I don't know if I can.
There we go. Yeah, there it is. And again. I'm doing more kind of just like subtle agitations. Let go. In your techniques, remember all our applications, massage applications day, like we call that vibration, but it's dysrhythmic. And again. A little component. And good, let go. And that would be it. Now, I've been more thorough in the past, but that has been one of my go-tos for patellar tendinitis, knee replacement stuff, so many things, because in that little routine, I've unstuck the 3 muscle compartments and then done a muscle energy technique. Now, sometimes it can be something different. It might be the rectus femoris. is like two-tonic or something like that. But that little sequence of going through has always bared out really good. And for something like patellar tendonitis, if this is the area that's getting pulled along, and that's why it hurts, reducing the tension of the whole anterior leg is going to create more slack for that tendon and the ligament underneath of it, although we call the lower part of the patellar, it's technically patellar tendon, patellar ligament. But both of those are happiest when these are looser, so that that's not put on tension. So just fixing that anyway is a really good thing for knee stuff, even though you can get the added value of inhibiting laterals and thereby encouraging better activation of medialis, which is another win in that, okay?